Sophia, you're on the air. How can we help you?
Hi, Dr. Wallach. Thank you so much for taking my call.
Thank you. What's up?
Okay, about 2 months ago in March, I caught a bad sinus flu, and 2 weeks later, I got an inner ear vestibular neuritis infection. I've been dizzy constantly, I have vertigo, lightheaded, fainting, filling, brain fog. I get a weird pressure in my head, ringing in my ears, and started getting anxiety attacks for the first time, for the very first time in my life, which is really scary. I had an MRI test done on my head. They detected mastoid hyperintensity of the mastoid disease, pretty much, on my left mastoid bone. And I've recently got a live blood cell analysis test from a holistic doctor, and they found bacterial parasites in my blood.
Okay, well, let's back up here. Let's back up. What does the medical doctors prescribe treatment?
They gave me motion sickness medication. They gave me antibiotics. They did prescribe me steroids, but I didn't take it. I had a bad side effect to the antibiotics, so I stopped taking that after 2 days.
Okay, now, do you still have... Okay, stop a minute now. Do you still have the same problem? Mm-hmm. Has it gotten worse, stayed the same, gotten better?
Yes, it's been the same every day.
Okay,
and getting worse here and there.
Okay, how old are you?
I'm 33.
Okay. And do you have any history of any other problems, such as asthma, bronchitis, or skin problems, eczema, dermatitis, psoriasis?
You know, I did have bad acne years ago, and my dermatologist put me on antibiotics and Accutane.
Okay. Do you have any history of arthritis or musculoskeletal problems, joint problems?
Not that I know of, no.
Oh, you'd know. Okay.
Thank you.
Any peripheral neuropathies, any tingling or numbness in your feet or toes or anything like that?
Yes, in my feet and my toes, hands and feet, sometimes when I'm sleeping.
Okay, so especially when you're sleeping. It gets worse when you lay down?
Yes.
Have you ever been to a chiropractor?
My vision has been a bit blurry.
Have you ever been to a chiropractor?
I have.
And has that given you some relief?
Yes, I have a lower back problem.
Did they give you some relief?
Right now, I'm going to upper cervical chiropractic right now, actually, for my lower back and my upper cervical.
And are you getting some relief?
A little bit.
Okay, Charmaine.
Yes.
Okay, here's a gal who's 30-something, and she's got all kinds of problems here, but she's been to chiropractor. She gets some relief. When she lays down, her problems are worse. She has neck problems, low back problems, and she had acne as a kid. And so what do you think is going on here?
I think she's got a gluten intolerance.
Absolutely. So why does she have ringing in the ears and vertigo, which is kind of like motion sickness and all this kind of stuff? Why is that happening?
Because she's got osteoporosis, too.
Osteoporosis where?
All over. But her inner skull, obviously, and her back.
Yeah, in her skull, her vertebrae, her back, every bone in her body. And this is what's going on here. And the doctors are using ambiguity. They're treating for every possibility here, including infections, and give her antibiotics and so forth. And this is a simple problem. What would you do for her diet-wise and supplement-wise, Charmaine?
Well, I don't know what she weighs.
What do you weigh here, Sophia?
I weigh 90 pounds. I actually lost about 12 pounds since being sick.
And how tall are you?
This is the lowest I've been. I'm 5'5".
5'5", you weigh 90 pounds. Yeah, you're skinny. Okay, what would you give her, Charmaine?
I'm very slender.
I would get her on a gluten-free diet for sure. No wheat, barley, rye, and oats, and then I would get her on a healthy bone and joint pack.
Okay, healthy bone and joint pack, one of those. And I'd get her some extra stuff there because she really needs two, but she's only 90 pounds. So what would you get her extra?
Get her extra bottle of glucogel. And also, she said she had brain fog. I'd get her on some Synaptive, too.
There you go. So, Char's exactly right. Get rid of all the bad stuff, no fried foods, no processed meats, no oils, no glutens. And then I would throw in one healthy bone and joint pack. Get an extra bottle of the glucogel, so you can take 15 of those a day, 5 at breakfast, lunch, and dinner. I'd also get an extra bottle of the osteo, so you could take an ounce at breakfast, ounce at dinner time. Everything else, take a half a dose at breakfast, half a dose at dinner time. And with that healthy bone and joint pack, you're going to get some CM cream. What would you have her do with that CM cream, Charmaine?
Rub it on all the spots where she has problems.
Okay. And I'd also take a Q-tip and put about a quarter of a teaspoon down into each ear with that Q-tip of that CM cream to try and relieve some of that inflammation, because specifically as that eighth cranial nerve is formed in the skull, or in the brain, comes through a tunnel in the skull. It's